Hello guys, today we are going to see about human assist devices important questions from unit 1. Okay, the first question is, a patient requires a cardiac transplant. Discuss the key indications that would necessitate such a procedure. What role do the heart-lung machine play in the process? The answer is, cardiac transplantation is a life-saving procedure typically performed for patients with end-stage heart disease. Here are the key indications for a heart transplant. Key indications for cardiac transplantations are, the first one is severe heart failure. In this severe heart failure, there are three reasons. Okay, the end-stage heart failure refractory to medical and device-based therapies, example medications, pacemakers or ventricular assist devices. This is often due to ischemic cardiomyopathy, damage to the heart from repeated heart attacks. The second one is dilated cardiomyopathy, weakening of the heart muscle due to various causes. Restricted cardiomyopathy, stiffened heart muscle, often from amyloidosis or fibrosis. The second one is congenital heart defects, severe congenital abnormalities, unmanageable through surgical repair. Third one is intractable ventricular arrhythmias, life-threatening arrhythmias that are not controlled with medications, catheter ablation or implantable defibrillators. Fourth one is valvular heart disease, severe valvular dysfunction not amenable to surgical or transcatheter intervention. Fifth one is cardiac tumors, rarely inoperable primary heart tumors like sarcomas may necessitate transplantation. Sixth one is cardiac allograft vasculopathy, graft failure following a prior heart transplant. Seventh one is severe functional decline, evidence of poor quality of life due to worsening heart failure with symptoms like fatigue, breathlessness and inability to perform daily activities. The diagram for this heart-lung machine is, the first one is patient, oxygenator, heat exchanger. From this, the reservoir to the pump to the filter, the femoral artery cannula, the right atrium cannula, blood reservoir and to filter. This is a block diagram of heart-lung machine. Okay. This is the practical diagram for heart-lung machine. This is a cardiopulmonary bypass machine, blood reservoir. From blood reservoir to the heart, from the heart to the oxygenator, blood return to body. This will oxygenate the blood. From the oxygenator to the gas out, heat exchanger, heater, cooler. The air oxygen combines together in the gas blender. From the gas blender, the gas will be given to oxygenator. Okay. Role of the heart-lung machine in the transplant process. The heart-lung machine or cardiopulmonary bypass plays a critical role in surgical process of cardiac transplantation. maintaining circulation and oxygenation. During the surgery, the patient's deceased heart is removed and the donor heart is implanted. The heart-lung machine temporarily takes over the function of the heart and lungs by circulating oxygen-rich blood throughout the body. The second one is hemodynamic stability. The machine ensures stable blood pressure and organ perfusion, preventing damage to vital organs during the procedure, facilitating surgical precision. By diverting blood away from the heart and lungs, the machine provides a bloodless field, allowing the surgeon to work with precision during the delicate steps of heart removal and implantation. Supports organ preservation. As the donor heart is connected and begins functioning, the heart-lung machine gradually weans off, ensuring a smooth transition to the donor. Donor's heart function. In summary, the heart-lung machine is an indispensable tool in heart transplantation, ensuring patient survival and procedural success during the critical phases of the operation. The second important question is explain the different types of oxygenators with relevant diagram. An oxygenator is a medical device that is capable of exchanging oxygen and carbon dioxide in the blood of human patient during operation. Okay, one component in heart-lung machine is oxygenator is a mixture of oxygen and 2 to 5% of CO2, carbon dioxide, is usually employed to avoid respiratory alkalosis. Normally, every oxygenator should oxygenate up to 5 liters per minute of blood. For an ideal oxygenator, the following conditions are required. There are 6 conditions. The first condition is lower priming volume, minimum trauma to blood, simple, safe and reliable operation, ensured sterilization, no microembolus formation, short preparation time. There are 4 types of oxygenators: bubble oxygenator, film oxygenator, membrane oxygenator, liquid to liquid oxygenator. The first one, bubble oxygenator, uses direct gas liquid contact where oxygen is bubbled through blood. Simple design with high gas exchange efficiency, can cause foaming and hemolysis, destruction of red blood cells, requires a deformer to remove bubbles before returning blood to the patient. Okay, this is a diagram of bubble oxygenator. There are some beads and sponges. Okay, the incoming blood is given, O2 inflow, pure blood, oxygenated blood. The incoming blood will be oxygenized with O2 inflow and the pure blood will be given outside. Okay, this is CO2 outflow. The next one is film oxygenator. Blood flows as a thin film over a surface exposed to oxygen, reduces direct bubble contact, minimizing hemolysis, provides moderate gas exchange efficiency. Less commonly used due to advanced in membranes technology. This is a diagram, okay, for film oxygenator. This is horizontal cylinder shape, rotating discs, O2, CO2, impure blood and pure blood. The impure blood and pure blood will be oxygenated using this rotating disc. Okay. The membrane oxygenator uses a semi-permeable membrane to separate blood and oxygen, prevents direct contact, reducing hemolysis and embolism risk, offers precise gas control and better CO2 removal. Most commonly used in modern extracorporeal circulation system. Example, ECMO. The diagram of membrane oxygenator is the AR and O2 will be given in the mixer. From there, fresh gas flow will be flowing to oxygenator, where the gas CO2 O2 is given. The first section is gas, the second section is blood. Okay, it combines together. In first section, the CO2 and O2, the gas molecules will be given outside. Okay, will be flow outside. Okay, the blood is will flow to return cannula. Okay, and the blood pumps, which is drainage cannula. From drainage cannula, the blood pump will be given to the blood section of oxygenator. Okay, the fourth type is liquid to liquid oxygenator. Oxygen is dissolved in a carrier liquid, example perfluorocarbon, and transferred to blood. Allows efficient gas exchange without direct gas exposure. Useful for microcirculatory applications and artificial blood research, still under experimental and limited clinical use. The diagram for liquid to liquid oxygenator is this one. This is gravity field, fluorocarbon inlet, which is given inside. Okay, rod bank, blood and water inlets. These are outlets. Fluorocarbon outlet. The line, this is the line for fluorocarbon flow, this is the line of cross flow. Okay, oxygenator are crucial components of the heart-lung machine, responsible for oxygenating and removing carbon dioxide from the blood during cardiac surgeries and heart transplants. This is the conclusion for this answer. Okay,